Well, hello, and welcome to my channel, Laura's Lupus. I just wanted to let you know that I am still here, still going at it, still fighting the battle of lupus. And I just wanted to come and I wanted to talk about a very important topic today. Okay, and so if this is your first time coming to my channel, please take the time to hit that like button and to subscribe and to hit the bell notification so that you'll know whenever I upload new videos. And then also for all of my subscribers that have stuck in there with me, I know it's been a long time. I'm still here. I'm going to be coming with some new information, some important information. And so I thank you. Thank you for subscribing. Thank you for sticking with me. And so today's video is very important because we're going to be talking about lupus active in the kidneys, which is called lupus nephritis. But I think this video is also very helpful and very important if you're dealing with any type of kidney issues, whether it's due to lupus or not. And I'm sorry about the light, you guys, I apologize. This is a very important video that you're going to want to stick around and that you're going to want to listen to the duration of the video. And so let's get into it. First of all, we're going to start with the kidney basics, which is what is the importance of the kidneys? Well, the kidneys are very important because they are the primary organs of what we call the renal system. And the renal system includes you have two ureters, the bladder, and the urethra. You also have two kidneys. And as we know with lupus, which is an autoimmune system, and it can affect almost any part of your body. It can affect your joints, your skin, your kidneys, your heart, your lungs, your blood, your brain. And so lupus is a very serious autoimmune system disease and it can show up anywhere. But today what we're going to talk about is how to recognize when lupus is active in the kidneys. And so we're going to have to start with the basics. What are the kidneys? What are they primarily responsible for? And just to be upfront, I'm getting this information from the Lupus Foundation of America and also some information in booklets and pamphlets that I received from my nephrologist when I was diagnosed with chronic kidney disease. So I'm talking from experience here. I've been going through this. I've remained positive and I've remained hopeful, but it's a journey. And for anyone that's been recently diagnosed with chronic kidney disease, it can be devastating. It can be scary, and we know that we have two kidneys, and if one is not functioning, we can always function and live with one kidney. But if both kidneys have been severely damaged, that means either you're going to have to be on dialysis for the rest of your life, or you're going to have a kidney transplant. And one thing about the kidneys, because we have two of them, when one is not functioning well, the other one will try to overcompensate. And that's something that we don't want to overwork the other kidney too. So today we're going to talk about the importance of the kidneys. We're going to talk about how to protect the kidneys, how to identify if lupus is active in the kidneys, what are the first telltale signs of chronic kidney disease. And so we're going to talk about a lot of things today, but we're going to keep it very basic. And then in my next video, I'll go into deeper details about some of the things that I'm going to mention today. So what is the importance of the kidneys? The kidneys are responsible for maintaining the correct amount of body fluids. Um, they get rid of waste products and toxins in our blood, and they regulate hormones that help control blood pressure and blood volume. And so, how do we know that lupus is active in the kidneys? Well, wait a minute, let me back up. I mentioned the word lupus nephritis, which means that lupus is active in the kidneys. And so the kidneys filter our blood. It keeps our blood cleaned out. And when anything is damaging those filters, it results in inflammation. And then the diagnosis is glomerulonephritis or nephritis. And it's a term used when lupus causes inflammation in the kidneys, making them unable to properly remove waste from your blood or control the amounts of fluids in your body. Whenever there's abnormal levels of waste that are built up in the blood, it can result in edema, which is swelling. And left untreated, it can lead to permanent damage of the kidneys, leading to end stage renal disease. And we'll talk about that more a little bit further on in the video. I'm going to try to keep this video very short. I'm not going to do 30 or 40 minutes. I'm going to try to get to 20 minutes and then cut it off, and then we'll pick up where we left off on the second video about lupus being active in the kidneys. And so, whenever there's a diagnosis of chronic kidney disease, there are 5 stages to chronic kidney disease, numbers 1 through 5. Numbers 1 through 3, there's some damage, but it can be reversed. Did you know that you can reverse kidney disease if it's caught early enough and if it's only in stages 1 through 3? When you get to stage number 4, it's not impossible, but it's very hard to reverse kidney disease. And when you get to stage 5 is known as end-stage renal disease. That's, as I discussed before, that's when you're going into dialysis for the rest of your life or looking for a kidney transplant. And by the time you get to stage 5, it is impossible to reverse the damage done to your kidneys. And so that's why a video like today, I'm going to talk to you about how to protect your kidney function. And a lot of times, some of the telltale signs that there is something going on with your kidneys is your high blood pressure. Uncontrolled high blood pressure. So the kidneys affect the blood pressure. And if there's uncontrolled high blood pressure where you find yourself, you were on one high blood pressure medication and now you got to be placed on 2 or 3, you may look into having your kidneys looked at. And if you have lupus, you should have a whole team of doctors. And one of the most important doctors to help you preserve your kidneys is called a nephrologist. A nephrologist can give you a tailor-made plan to help you through all the stages of your chronic kidney disease. They can give you diet plans, medications, run all of the much needed tests that a regular MD may not be able to or may not be familiar with. And they can just help you to go through life and preserve your kidneys and help you to live and to cope with chronic kidney disease. And so, as I stated before, there are different stages, different levels of kidney disease. But the first thing is, and we talked about that depending on what stage you're in, that kidney disease, it can be reversed. So that should be hopeful. But how can we protect our kidneys? And well, let's back up. Let's start with what are the signs that lupus is active in your kidneys or that something is going on with your kidneys. Because a lot of times by the time we have a test or by the time we really start seeing signs that there are problems with our kidneys, there's been a significant amount of damage already done to the kidneys. But like I said, there is hope because depending on what stage you're diagnosed with, it can be reversed. So what are the signs that lupus or that there's something going on with your kidneys? And what are some of the first things that the doctor will do in order to diagnose a problem with the kidneys? Well, first of all, you need to get yourself a nephrologist, and the nephrologist will run a couple of tests, but the main two is the urinalysis and the blood test. When they run a urinalysis on your kidneys, they're looking for fragments of cells that are not normally found in the blood that the kidneys are putting out there, and it shouldn't be in your blood, and it shouldn't be in your urine. The urinalysis will also look for protein. That's one of the first signs that there is something going on with your kidneys because protein should not be showing up in your urine, and it shouldn't be showing up in your blood. And also blood in your urine. Those are the signs that there's something going on with your kidneys when your doctor gets to the stage where they have to run some tests. When they run the blood test, they're looking for your creatinine level, and they're looking for your BUN, which is your blood urea nitrogen level. Now, the important one is the creatinine, because the creatinine tells you if your body, if your kidneys are functioning out waste out of your blood properly. Okay, because if it's not, then that's what leads to dialysis, where you have to go and you get hooked up to a machine, and this machine cleans out your blood. And sometimes you have to go 2 times a week, 3 times a week, 5 times a week. You have to be hooked up to this machine for hours while it takes out all of your blood, clean out all of the waste and all of the toxins. And so if your body is not, if your kidneys are not properly cleaning out waste and toxins, those toxins will build up in your blood. It will build up in your body, and it will lead to problems or symptoms such as unexplained swelling, especially in your extremities, your feet, your ankles, your legs, your fingers, your arms, and even you may get that puffiness in your under your eyes. There will be blood in your urine. There will be an elevated blood pressure. Like I said, the kidneys and the blood pressure are connected. You know, if the kidneys are not working right, one of the telltale signs is uncontrolled high blood pressure. There will be a foamy appearance to your urine. So it's very important. Our urine, our blood, all these are things that tell the doctor so much about the health and condition of our bodies, through the blood and through the urine. And that is how they diagnose if there's any type of kidney disease. They will do other tests as well that are more involved, um, but the blood and the urine are the two main tests. Also, if there's an increased urination, especially at night, even if you find yourself, you stop drinking water at 6, or you stop drinking anything by mouth at 8 p.m., and if you're still getting up in the middle of the night going to the bathroom, okay, that's a sign that there could possibly be something wrong with your kidneys, especially if you're a lupus patient. Two other things that will show up as symptoms if there's activity of lupus in the kidneys. There will be sometimes low potassium. Also, there will be pain in your abdomen or in your lower back. Um, your two kidneys are located right under your pancreas and right on the side. There's one on the left and one on the right. And so if there's pain in that area, if there's pain anywhere in your abdomen or in your lower back, that could be a sign that there's something going on with your kidneys and you want to have that checked out. Another thing, and this is the last one, putting out too much or too little of urine. You know, all of us have a certain amount of urine that we put out every day, and that's the norm. But when it gets to the point where you're having a hard time urinating, or you're putting out a very little urine, or you're putting out too much urine, that's a sign or a symptom that there's something going on with the kidneys, and that lupus is active in the kidneys, causing the lupus nephritis. And so now the next thing that I want to talk about is how can you protect your kidneys? How can you, even if you've been diagnosed with chronic kidney disease, how can you protect the kidneys for the duration of your life? Number one, by taking prescribed medications. And I should say that's number two. Number one, get to a nephrologist. And that nephrologist should be the one that gives you a diagnosis of nephritis or glomerulonephritis. Number two, take your prescribed medications. It is so important, especially for your blood pressure medicines. You don't want your kidneys being overworked by high blood pressure. Okay, having high blood pressure, it puts an insurmountable of pressure and causes the kidneys to overwork. You know, even while you're sleeping, if your blood pressure is high while you're sleeping, your kidneys are working. They're working. And so we want to take as much pressure off of the kidneys as we can. And so what's a good blood pressure? It's 120 over 80. Anything below 120 over 80, that's the magic number that you want to be at for your blood pressure. Okay, so make sure that if your doctor has prescribed you blood pressure medication, take that. You know, be faithful to taking your medications or whatever medications they've prescribed for you. Make sure that you are faithful to taking those medications. The next thing is to change your diet. There are so many things in our bodies, there are so many medical issues that can be reversed, and kidney disease is one of them if you change your diet. And it's better to change it sooner than later. And what do I mean by that? Staying away from foods that are high in sodium, which is salt. Our bodies are only allowed 1,200 milligrams of salt per day. And let's say if you eat something with 900 milligrams of sodium, your next snack or your next meal could put you over that 1,200 milligrams, which if your body is trying to, if your kidneys are trying to get rid of salt and toxins and waste and everything, and if you're eating too much salt and your blood pressure is high, like I said, your kidneys are overworking. And we want to protect those valuable parts of our body, which is one part is the kidneys. The heart, the lungs are very important, but the kidneys are just as an important function to the wellness of your body. Okay. Stand away from foods that are high in sodium. Stand away from foods that are high in potassium. Stand away from foods that are high in phosphorus. And in my next video, I'm going to go into more detail as far as the effects of sodium, phosphorus, and potassium, and how to what are their functions in the body. I think that needs to be explained. The importance of, sodium, phosphorus, and potassium. And then I'm going to go into a list of foods that either you need to eat in moderation or stay away from in order to keep these levels low. Another thing with high sodium, some of us, we eat or we were eating frozen, healthy meals. But if you flip it over and you look at the labels, some of those frozen, supposedly healthy meals contain high amounts of sodium. And so, make sure that you're reading labels when you go to the store. You have to read the labels. When you pick up something, read the labels. Let your eyes scroll down, number one, to the sodium level. And if it's like 600, 700, 900, put it away. Another thing that I had to do was go through my cabinets and clean out my shelves. All foods that were high in sodium in my refrigerator and my cabinets, I got rid of them. And sodium can show up in anything. It's in your ketchup. It's in any food that you eat, your bread, your cereals. Some foods contain more sodium than others. And then nowadays, sodium is being used as a preservative to keep our food on the shelves longer. And so it's doing a lot of damage to our bodies. It's doing a lot of damage to our kidneys, our blood pressure. It's causing people to go into, to have diabetes. It's affecting the older adults, middle-aged adults, young adults, and even children are having these problems from consuming too much salt in our diets. And fast food is the number one. Whenever you go to McDonald's or whatever fast food place you go to, in order for those foods to be preserved, they fill them up with high levels of salt. So even if you're buying a package of chicken, chicken fillets, even if you're buying boxed foods like fish sticks, read the labels. Look for, number one, high amounts of sodium, look for phosphorus, and look for the potassium level. Another thing, as far as phosphorus, you have to be careful with that because that's found in all canned foods. And we'll get into later what these three things, what they do. Our body needs certain amount of sodium, phosphorus, and potassium. But when we go overboard, that can have an adverse effect on your kidney. So you want to be careful with that. And so for me, I had to get rid of all my canned foods. I can't eat canned foods. Campbell's chicken noodle soup is great, but I can't eat it. If I do, that means that I've met my or very close to my sodium level for today, and so for that day. And so I have to be careful, not saying that occasionally you can't eat something from the can, but you just have to make sure, get yourself a notebook and keep up with the foods that you're eating and how much sodium is contained in each one, because you know what, you could meet your sodium level breakfast and a snack, and that's all the sodium you can have for the day. Sodium is in your orange juice. You know, sodium is in your grape juice. It's in your grapefruit juice. It's in sodium is in so many things. And another thing that I did, I took the salt shaker off the table. I threw away any of my boxes of salt, any salt substitutes. I got rid of all of that in order to protect and preserve my kidneys. And so I know it may sound drastic. You may not like the foods that you're required to eat, but what would you rather do? Would you rather save your kidneys, save your life, or be diagnosed with, end stage renal disease and be on dialysis, or have to wait around for a kidney transplant that may take too long to come? Okay, so it's a choice that we have to make. We may not always enjoy what we have to do, but if it's for our health, my friend, it's worth it. No questions for me. In order to save my health, to save my life, and to preserve my kidneys, because when I found out that I had chronic kidney disease, I was devastated. It was scary, you know. And so I started whatever the doctor told me that I needed to do, and I did my own research, and I contacted the American Kidney Foundation. I got all the information that I could about kidneys and what I can do to preserve my kidneys, and I followed that to the T. Okay? Um, so those are ways that you can preserve your kidneys. And then I wanted to talk about, this is the last thing before I end this video because I'm already at 21 minutes. Another way that you can preserve your kidneys is that we need to stay away from or watch the over-the-counter medications that we're taking. And this is something that I learned from my doctor. He gave me a complete list of ways that I can protect my kidneys, and one of them was to stay away from over-the-counter medications. And even if you don't have kidney disease, if you have high blood pressure or diabetes or any type of medical condition, before you take any type of over-the-counter medications, you need to consult your physician first. Okay, first and foremost. And so the over-the-counter medications that those of us with chronic kidney disease or lupus nephritis, we need to stay away from laxatives. Laxatives can be very hard on the kidneys and overwork the kidneys. We need to stay away from NSAIDs, which are pain relievers, such as ibuprofen, Aleve, any type of painkillers can overwork the kidneys. The safest one on the market is Tylenol. And even with the Tylenol, everything needs to be done in moderation. So if you're taking Tylenol, it's not something that you should take for a whole year, or take more than the recommended dosage, because it will cause adverse damage and cause your kidneys to overwork. So be careful with all of that. Read your labels, but the safest NSAID out there or pain medication for those of us that are dealing with lupus nephritis or kidney disease is your Tylenol. Also, stay away from cough and cold medicines. You know, um, it's something that's been well known that cough and cold medicines, over the counter cough and cold medicines, can cause high blood pressure or raise your blood pressure if you're already a high blood pressure or blood pressure patient. These cough and cold medicines can also affect your kidneys. And anything that raises your blood pressure will affect your kidneys and cause your kidneys to overwork. And we don't want that. We want to preserve the kidneys. So I think that I covered everything today that I wanted to talk about. On the next video, like I said, we're going to get more into the other tests. We're going to talk about the types of tests. We're going to talk about creatinine. We're going to talk about your BUN, which is your blood uric nitrogen levels. We're going to talk more about phosphorus, sodium, and potassium. And then we're going to talk about other lupus-related issues with the kidneys. Lupus can cause other issues with the kidneys, not always chronic kidney disease, but there are several other issues that can show up in the kidneys related to lupus, but doesn't really mean that you have chronic kidney disease. So this video is for those of us who have chronic kidney disease And we'll talk more in the next video. We'll go deeper um, into what all of this means, what a diagnosis mean. Like I said, what foods you can eat, what foods you can stay away from, and how you can preserve your kidneys, and how you can live out the rest of your days without overworking your kidneys or causing, if you've been diagnosed with chronic kidney disease, causing your kidney disease to advance to higher levels. Okay. And like I said, if you're in stages 1 through 3, I'm not saying that you shouldn't worry and that you shouldn't start doing things to take care of your kidneys, because no, you should. But if it's at stages 1 through 3, it can be reversed. When you start getting to stages 4 and 5, it's very difficult, my friend, to reverse and everything, almost impossible. But anyway, I just wanted to come on here with this short video. I felt led to talk about this. We hear so much about so many people out there dealing with, chronic kidney disease, with lupus nephritis, and just trying to wrap their heads around what's going on with their bodies. And sometimes, a lot of the information it's not available. You have to do your own research. You have to ask questions. You have to take your kidney health into your own hands. You have to be your best advocate. You have to ask the questions. You have to talk to your doctor. You have to talk to your nephrologist. You have to watch for the signs, and you have to take those drastic steps to improve your kidney functions. Okay. So thank you so much for taking the time to listen to me, and for sticking with me on this channel and staying with me to the end of this video. I appreciate you all. And remember that there is life after lupus. Be blessed, my friends. Bye for now. Catch you on the next video.